Did you know that in 2026, some Canadian seniors could technically be breaking the law just by renewing their driver's license or forgetting to fill out a benefits form on time? Sounds unbelievable, but it's true. With a wave of new policies, rule changes, and stricter enforcement across the country, many older Canadians are being caught off guard, and some headlines are even calling it a war on seniors. From tighter healthcare paperwork to digital ID rules and surprise tax filing penalties, what's really happening? Are these laws meant to protect seniors, or are they quietly turning everyday citizens into accidental offenders? In today's video, we're diving into 10 shocking new Canadian laws in 2026 that could have serious and unexpected consequences for seniors. Some might seem harmless at first glance, but the fine print tells a different story. Stick around, because the truth behind these changes may surprise you. Number 1. Driving tests targeting seniors. Starting in 2026, provinces across Canada have introduced new mandatory driving assessments for seniors over the age of 70. While the government insists this is a safety measure, critics argue it unfairly singles out older drivers. The updated regulations now require seniors to undergo regular medical, cognitive, and vision tests in order to renew their licenses, even if they've never had an accident or traffic violation. For some, this feels less like a safety initiative and more like age-based discrimination, hidden under the label of public safety. What makes this law especially alarming is the vagueness in how assessments are judged. Some provinces allow healthcare providers or licensing officials broad discretion to recommend license suspension, even based on minor concerns. Imagine failing your license renewal because you paused too long answering a question during a memory test. It's not far-fetched under these new rules. And for seniors living in rural areas without public transit, losing the right to drive could mean losing independence entirely. The real concern isn't just about fairness. It's about how quietly these changes have been rolled out. Many seniors weren't even aware of the new standards until they received unexpected letters or failed assessments. And with penalties including suspension of licenses and mandatory retraining programs, seniors could suddenly find themselves labeled non-compliant or even facing fines simply for missing a medical form. While road safety is vital, the question remains, are seniors being unfairly targeted under the guise of protection? Number 2. Bank transfers now raise red flags. Suddenly, transferring money to your grandchild or moving savings between accounts could trigger a fraud investigation. In 2026, Canada's financial crime reforms introduced stricter surveillance on electronic transactions, with a specific focus on preventing money laundering and scam activity. But here's the twist. Seniors, who are often more vulnerable to fraud, are now being flagged more often than ever, even for routine banking. The law requires banks to report suspicious activity faster and more frequently, and unfortunately, suspicious isn't clearly defined. Worryingly, the system doesn't differentiate between a confused online transfer and actual criminal behavior. Seniors who struggle with digital banking, forget to label transfers, or send larger amounts for medical expenses or family support are now at risk of being flagged for financial review. In some cases, accounts have been frozen without warning simply because the transaction didn't fit a bank's new internal profile for normal behavior. This means many older Canadians are being treated like suspects, not victims, by the very institutions meant to protect them. What's even more frustrating is that many seniors aren't told in advance that these rules exist. No letter, no warning, just sudden limitations on their access to their own money. And if flagged, they may be required to verify identities in person or submit documents they haven't used in years. For someone living on a fixed income, this delay in accessing funds can be devastating. The intention behind the law may be good, but in practice, it's placing undue pressure on seniors, making them feel watched, restricted, and in some cases, unintentionally criminalized for simply trying to manage their finances the way they always have. Number 3. Miss a form, lose your pension. Surprisingly, one of the biggest threats to seniors in 2026 isn't crime or scams, it's missing paperwork. New administrative rules surrounding Canada Pension Plan, CPP, and Old Age Security, OAS, benefits now demand stricter annual verification for recipients. While these changes are meant to improve accuracy, they're catching many seniors off guard. If a required form isn't submitted on time, or worse, if it's lost in the mail, seniors can suddenly find their benefits paused or canceled without much warning. Frustratingly, the government has shifted much of the responsibility onto seniors themselves. You must now actively prove your eligibility every year, even if your situation hasn't changed. That means keeping up with mail, knowing when to respond, and navigating complicated online portals that many older adults struggle to use. Some have reported waiting months to get their benefits reinstated after a minor paperwork delay, often with little assistance or clear explanation from Service Canada. What's more troubling is the quiet rollout of these changes. No major headlines, no national campaign to educate seniors, just new rules buried in official updates. And the consequences are severe. Missing a single form could mean going without income for weeks or months, forcing some to borrow money or cut back on basic needs. It's not about fraud or bad intentions. It's about a system that punishes honest mistakes. And with many seniors relying on fixed incomes, these bureaucratic hurdles feel less like oversight and more like a system stacked against them. Is it really fair to let red tape decide whether someone eats or pays rent on time? Number 4. Medical bills becoming legal traps. Unexpectedly, seniors are now being drawn into legal trouble over healthcare billing disputes they didn't even know existed. In 2026, provinces began cracking down on what's called extra billing, where clinics or specialists charge patients fees beyond what's covered by public health care. While the intent is to enforce fairness and compliance with the Canada Health Act, it's seniors who are often left paying the price, literally and legally. If a senior unknowingly pays for a service that shouldn't have been billed, they could become part of a complaint, investigation, or worse, be asked to testify or repay. What complicates this further is the lack of clarity around what is and isn't allowed. Many older Canadians rely on their doctors and clinics to guide them, but the fine print often gets missed. A physiotherapy session, a minor diagnostic scan, or even a consultation fee can now fall into a legal gray area. Seniors who are simply following medical advice could find themselves caught in administrative battles, questioned about payments they thought were routine. In some cases, providers have shifted responsibility to patients, asking them to sign vague consent forms that waive rights, forms that few fully understand. Adding to the confusion, enforcement has been inconsistent. Some clinics have stopped offering certain services to avoid the risk, while others continue charging as usual, leaving seniors in a legal limbo. What was once a trusted healthcare interaction is now becoming a bureaucratic minefield, with a patient, especially older patients, can be left footing the bill or dragged into compliance audits. It raises a difficult question. When seeking care becomes risky, how many seniors might simply avoid it altogether? And who really benefits from that? Number 5. Simple mistakes can suspend healthcare access. Imagine going in for a routine appointment and being told your provincial health coverage is inactive, all because of a minor paperwork issue. In 2026, several provinces have implemented tighter controls on health insurance eligibility, especially for seniors who travel, move between provinces, or fail to update personal details like address or marital status. These new rules may sound harmless on paper, but they've led to an alarming number of seniors having their coverage suspended without notice, sometimes for months. Unlike before, where updates were often automatic or handled by care providers, the burden now falls squarely on the patient. Seniors must ensure their documents are accurate and regularly updated, or risk being flagged as ineligible. This includes submitting renewal paperwork, residency proofs, and even income updates depending on the province. For many older adults who are not tech-savvy, this shift has made navigating the healthcare system more stressful and error-prone. And when mistakes happen, there's little mercy. Missed deadlines or incorrect forms can lead to denied appointments, delayed prescriptions, or surprise bills. Equally troubling is the lack of support when things go wrong. Seniors are often left on hold for hours trying to reach provincial health offices or are told to fix issues online, systems that are not always accessible or senior-friendly. And while there's no criminal penalty for a missed update, being treated as non-compliant means being pushed out of a system they've contributed to for decades. It's not a matter of fraud or abuse. It's a matter of falling behind on new rules that were never clearly explained. At the end of the day, shouldn't the system serve those who need it most, instead of punishing them for paperwork? Before we dive into the next point, if this video is opening your eyes to things you didn't know, pause for a second and drop a comment below. Have any of these laws already affected you or someone in your family? We read every single one. And if you appreciate the research and effort we put in, hit that subscribe button. It's just one click, but it helps us keep going. Number 6. Filing taxes late now comes with bigger risks. 4 years. Missing the tax deadline meant a fine or a delay. Annoying, but manageable. But in 2026, new federal enforcement measures are making late tax filings far more serious, especially for seniors who rely on benefits like the Guaranteed Income Supplement, GIS, OAS, or provincial housing support. If a senior fails to file their return on time, even by a few days, those payments can now be automatically paused. What was once a simple oversight is now treated like a major compliance issue, with harsh and immediate consequences. Unlike in the past, there's now no grace period in many cases. Seniors who have always filed paper returns or needed help from community tax clinics are struggling to meet the tighter timelines. Complicating things further, some are unaware of the new rules until they stop receiving their benefits. For those living on fixed incomes, losing even 1 month's payment can mean skipped bills, missed rent, or food insecurity. The stress this creates can take a real toll on both mental and physical health, all because of a bureaucratic deadline that was poorly communicated. Most frustrating is that this system assumes digital access and financial literacy that many older Canadians simply don't have. Seniors without internet, computers, or nearby assistance may have no idea they've done something wrong until it's too late. While filing taxes isn't a crime, failing to meet these tighter deadlines can feel like being punished for aging in a digital world. The government may claim it's about efficiency and fraud prevention, but for thousands of seniors, it feels like the system is being built for everyone, except them. Should a late form really mean losing your lifeline? Number 7. Estate transfers now under scrutiny. Quietly, in early 2026, Canada introduced new federal rules requiring more detailed reporting on property and estate transfers, with a specific focus on catching tax avoidance and financial misreporting. While these laws aim to close loopholes used by wealthy investors, they're also affecting everyday seniors who are simply passing down property, savings, or assets to their children. What used to be a simple family arrangement, transferring a home, gifting savings, or listing a joint bank account, now comes with forms, declarations, and the risk of audit. Confusingly, the new regulations don't clearly distinguish between major financial maneuvers and common family support. If a senior transfers partial ownership of a home to a child to help with caregiving or adds them to a bank account for easier bill payments, it could now be flagged as a reportable transaction. This means it must be declared to the Canada Revenue Agency, and in some cases, could trigger unexpected taxes or penalties. Seniors acting out of good faith, often with no financial gain, may find themselves tangled in a system that views their choices as suspicious. What's most concerning is that many older Canadians have never been told these rules changed. There were no major announcements, and the language used in tax guides is difficult for non-experts to follow. Seniors who make mistakes or fail to report properly aren't treated with leniency. Instead, they may face audits, fines, or even frozen accounts while things get sorted. For families trying to manage care, inheritance, and support during already stressful times, these added legal hurdles feel like punishment, not protection. The question that remains, are seniors being unfairly treated like tax cheats simply for helping their loved ones? Number 8. Working after 65 comes with new challenges. For decades, seniors who chose to keep working past retirement age were praised for staying active and contributing to the economy. But in 2026, new updates to labor regulations are making that choice more complicated than ever. Recent clarifications to employment laws now require employers to report more details about senior workers, including their roles, hours, and benefit eligibility, all in the name of transparency and equal treatment. However, these well-intentioned changes are creating confusion, delays, and even hiring hesitations when it comes to older employees. Unexpectedly, some employers are now avoiding hiring or extending contracts for workers over 65, simply to sidestep the additional paperwork and perceived legal risks. Seniors who are fully capable and eager to contribute are being subtly pushed out of roles they've held for years or turned down for part-time jobs they need to supplement their fixed income. It's not a legal discrimination in the traditional sense, but it's a growing gray area that leaves older Canadians feeling sidelined. Ironically, a law meant to protect against ageism may be inadvertently making it harder for seniors to stay employed. What makes this situation even more difficult is that many seniors are unaware of their rights. They assume losing a job offer is just bad luck, not realizing the system is quietly shifting around them. Legal protections exist, but the burden to challenge unfair treatment lies with the senior, and navigating a labor complaint system isn't easy at any age. With inflation still climbing and retirement savings stretched thin, working into your late 60s or early 70s isn't always optional. And yet, the very institutions meant to support fair access to employment seem to be closing doors, not opening them. Number 9. Surprise fees from covered health services. Without warning, more seniors in 2026 are being hit with unexpected medical fees, even for services they believed were fully covered by public health care. This is due to a tightening of enforcement around what provinces can and cannot bill for under the Canada Health Act. While aimed at cracking down on clinics that abuse billing loopholes, these rules have created a confusing environment where seniors are left paying the price for the system's lack of clarity. You may think a test or consultation is covered, only to receive a bill weeks later labeled as a non-insured service. Worse still, many of these charges are now legally enforceable if you agree to them, even unknowingly. Clinics and practitioners have begun using pre-visit forms and waivers that include small print authorizing extra billing. Seniors often sign these forms without fully understanding what they're agreeing to, especially when rushed or confused. And once signed, they may be legally responsible for those costs, with no recourse, even if the charges were misrepresented. This has led to situations where seniors are receiving collection notices or threats of legal action over fees they didn't expect and wouldn't have agreed to if they'd known the full story. Adding to the problem is the lack of oversight and patient advocacy. Provincial governments have not made it easy to dispute charges or report misleading billing practices. Many seniors feel powerless, unsure who to turn to or how to contest the charges without legal help. This creates a chilling effect. Instead of challenging questionable fees, many simply pay to avoid stress. But the question must be asked, is our healthcare system becoming less about care and more about cost, especially for those who can least afford it? Number 10. Digital consent now legally binding. Quietly introduced alongside data protection reforms, a 2026 law now makes digital consent agreements fully binding, even for seniors who may not fully understand what they're agreeing to. Whether it's clicking I agree on a pop-up, signing a tablet screen at a pharmacy, or using an app connected to a government service, these digital interactions now carry the same legal weight as signed paper contracts. While intended to streamline services and protect data privacy, this change is putting seniors at serious legal and financial risk. Alarmingly, many seniors are unknowingly agreeing to terms that allow third parties to access personal data, share medical records, or even authorize charges. The language used in these agreements is often complex and buried in fine print, making it difficult for non-tech-savvy users to grasp what they're signing away. And once consent is given, it can be extremely hard to reverse, especially if services or transactions have already taken place. This means a single mistaken tap on a screen could lead to unexpected bills, data breaches, or denied claims, with little ability to argue the case after the fact. What's most concerning is the lack of safeguards for vulnerable users. Unlike in-person transactions, where a staff member might explain the details, digital systems are impersonal and fast, leaving no room for clarification. Seniors are expected to navigate this digital landscape on their own, even when their health, finances, or privacy are at stake. And while the intention may be to bring Canada in line with global tech standards, the execution leaves seniors exposed. Should someone really be held legally accountable for clicking a button they didn't understand? Or is this another example of how technology is outpacing our ability to protect those who need it most? As we've seen today, 2026 is not just another year of policy updates. It's a turning point that's quietly reshaping how seniors live, work, and access essential services in Canada. From stricter driving assessments to complex estate reporting, many of these laws were introduced with good intentions, like improving safety and preventing fraud. But in reality, they're creating new burdens, legal risks, and unexpected consequences for the very people they claim to protect. Seniors are being held to standards they were never prepared for, and in many cases, not even informed about. What makes this even more troubling is how easily these changes can turn everyday mistakes into legal issues. A missed form, a misunderstood digital agreement, or a delayed tax return, things that once resulted in a gentle reminder, can now lead to suspended benefits, frozen accounts, or even accusations of noncompliance. While these laws may not call seniors criminals outright, they're creating a system where older Canadians are treated more like liabilities than valued citizens. It's time we ask, are we building a country that supports its aging population, or one that quietly punishes them for not keeping up with an increasingly complex system? Understanding these laws is the first step toward protecting ourselves and our loved ones. So whether you're a senior, a caregiver, or just someone who cares about fairness, this conversation matters more than ever. If any of these laws shocked you or affected someone you know, we want to hear your thoughts. Drop a comment below and share your story. Your voice matters more than you think. And if you found value in this video, please support our work. We put hours of research into every episode to bring you the truth behind the headlines. So go ahead and hit subscribe. It's just one click, but it means everything to us.